Welcome back as we journey through implementation strategies for the new patient experience. In the previous lesson, I discussed ways to filter patients through a phone call and set up the patient and team members for an exceptional experience at your office. In this lesson, I'll cover how to prepare the team for success before the patient visits. Just like in sports, proper preparation and training will set you up to do your best every time. We too focus on being best prepared for a new patient's arrival. Once an appointment is made, there is still a lot to do before the patient arrives. Unfortunately, for many practices, the preparation needed to make a patient feel at home when they enter the office is often skipped, only to the detriment of the patient and the practice. To create a welcoming experience for a new patient at our practice, we have a trained team member who acts in the primary job role of a new patient concierge. I mean, if a hotel can have one, why can't a dental office? Like a hotel concierge, a new patient concierge guides new patients to the office amenities, aids in their visits, and helps with questions. Depending upon your office size and new patient flow, the concierge may be one individual, or you could delegate concierge responsibilities among multiple team members. However you handle it, it's essential to have the entire team aligned and systems to fulfill the tasks needed for an exceptional new patient experience. For us, spreading concierge tasks across team members was too much to manage. Yet, we were committed to delivering the exceptional personal experience. So we decided having 50 to 75 new patients a month, adding a new team member was justified. As I discuss the concierge job role, I want you to think about your team and what they are currently doing in the office to prepare for a new patient. You'll find where there may be opportunities to expand a team member's responsibilities or assign accountability for a portion of appointment preparation. So, what's the one thing patients hate more than seeing the dentist? The paperwork. And I bet you and your team can commiserate in the same boat with them. But to be excellent, we need to start with a thorough and accurate record with the patient's chart. We use all the crucial information from that wonderful phone intake form we discussed in an earlier lesson to assemble the patient's chart. In our office, every team member is trained and expected to answer the phone if they are available. During the phone call, a basic chart with the patient's name is created to reserve the appointment time in our schedule. That phone intake form is then put in a designated new patient mailbox for our concierge to take it from there. This way, no matter who takes the initial phone call, all the information gets funneled into a central location and is sorted by one person, the concierge. This helps reduce miscommunication. Now, the fun begins for our concierge. They need to figure out what's missing from the patient's chart and to stay on top of that leading up to the appointment. Things like, how was this patient filtered? Is the patient transferring from another practice, and do old records need to be obtained? Was the patient referred to us, and if so, why? Is there more pertinent information missing from the phone intake form? And then when is the scheduled appointment, and how much time is there to get what is needed? This ensures an accurate and complete record before handing the patient off to the clinical team. And you ask, why do we do this? Because for our team to deliver the best dental care possible, we need to acquire as much of their information before the appointment time. The date of the patient's appointment plays a key factor in setting the priority level of collecting what is needed. But if the appointment is for an urgent or emergency filtered patient, the concierge is going to need court sense at that appointment and have a checklist ready to obtain the missing information for the patient. Part of an exceptional new patient experience includes the office team helping the patient review their benefits and making financial arrangements instead of the patient trying to navigate those complexities alone. It's the one thing that sets our practice apart. Also, before the appointment, our office team sends the new patient a welcome packet, which includes forms that they can fill out before arriving. There are multiple ways to accomplish paperwork using traditional mail, email, or a third-party service. Our team uses an adjunctive service to ensure our scheduled patients receive electronic forms to fill out in a timely manner prior to their appointment. There is still, however, some older patients who prefer hard copy forms. We continue to send paper forms for them, and sometimes we even invite them to the office ahead of time to help fill them out. It's important for our team to accommodate the patient, making the paperwork process very simple for them. There are many ways forms can be organized or collected, so this may be an excellent topic to utilize in a team meeting. Think about the forms you are using today or would like to use and the opportunities to streamline paperwork mini systems at your office. Office forms give us consent to do our best work, but they also support our team to have productive financial, benefit, and health conversations with the patient during the appointment. Therefore, our office forms and the team must be structured to support each other. Job roles for team members should be structured and defined so that they can support each other well. Without them, there's inefficiency and confusion. So, if you have a small team, one person may do everything in the office, but what happens when that team member isn't there? If you have a larger office and designated someone as a concierge, what happens when they aren't in the office? Here are some things to consider regardless of what kind of practice you have. Who has the financial discussions with the patient? Do the forms and office policies allow the concierge to do their best? Think about your health history form. Does the form give you a thorough look at the patient's overall health for your providers to evaluate? The mini systems your team uses and the people in charge of it will vary, but determining responsibility through meetings is the
Get those
best way
nasty
to
balls
position
off
your
of my
practice
mouse.
and team members for success. For example, due to our high new patient flow, we created the concierge role because it allows the team members to continue with a high level of focus on their primary job role. My office team now consists of 4 primary roles held by 4 individuals: treatment coordinator, insurance coordinator, financial coordinator, and the new patient concierge. All the roles overlap, and each person has been cross-trained to support each other and to help clinically in a pinch. Their job titles are not the critical part here, but what is
Well,
essential
that's
is
not
that the
good.
new patient forms fulfill what each job role needs to do
You're
their
just
best
reading
when the
off the
patient
screen.
arrives.
That's
Regarding
annoying.
forms, the main goal of the concierge is to audit the chart leading up to the appointment. They figure out what we need for insurance information,
Got these
financial
out.
information, and consent. This helps other team members have productive insurance and financial discussions and
Okay.
ensures the clinical team has the proper permission to evaluate and treat the patient. So, the concierge thinks, do we have what we need? Is the information we obtained accurate and usable? What are we missing? How can we complete this record before the patient arrives? For the chart, they think,
It's
is
probably
there a
correct.
benefit plan and is it
That's
verified?
most likely
Are
correct.
there old radiographs? And if so, when were they taken and what do they show? Did we send thank you for the referral? Did the forms get returned in time? We need to compile and review all the information we've gathered before making our next phone call to the patient, the
I'll go
courtesy
check.
call. But before we get into the courtesy call, now is a suitable time to really consider your team's job roles and how they are currently compiling and checking all this new patient information. Are there opportunities to be more efficient? Is there room for improving more direct or effective communication in the process? Does anything fall through the cracks? All team members require different information to do their best, but sometimes we fail to recognize how crucial the support of the office team is in allowing us to deliver exceptional care. Taking some time to think about it before watching the next lesson. I hope you and your team can work together and find areas in your office to improve the new patient experience.